Our digestive system is truly remarkable. It's responsible for breaking down the food we eat, absorbing nutrients, and eliminating waste. But imagine a traffic jam on this crucial highway. That's essentially what happens with intestinal obstruction. This blockage can occur in the small intestine or the large intestine and can be partial or complete. Early detection and treatment are essential in preventing potentially life-threatening complications. Knowledge is power, and being informed about this condition can make all the difference in your health journey. Our bodies have a remarkable way of communicating distress signals when something's amiss. Intestinal obstruction is no exception. One of the most telltale signs of intestinal obstruction is severe abdominal pain, often described as cramping or colicky. Another red flag is persistent vomiting, which can sometimes contain bile, a greenish-yellow fluid produced by the liver. Constipation, or the inability to pass gas or stool, is another alarming symptom indicating a potential obstruction. If you experience any of these symptoms, especially in combination, it's crucial to seek immediate medical attention. Ignoring these warning signs can lead to dehydration, electrolyte imbalances, and even life-threatening complications. Abdominal pain is a common ailment, often attributed to indigestion or gas. However, when it comes to intestinal obstruction, the pain is distinct and demands attention. The intestines contract rhythmically to move food along. When an obstruction occurs, these contractions become more forceful, attempting to overcome the blockage. This results in intense cramping pain, often described as colicky pain. The location of the pain can provide clues about the obstruction's location. For instance, pain in the upper abdomen might indicate a small bowel obstruction, while pain lower down could suggest a large bowel obstruction. Always err on the side of caution and seek medical advice to rule out any serious underlying conditions. Vomiting is the body's natural defense mechanism to expel harmful substances. When the intestines are blocked, the contents cannot move forward, leading to a buildup of pressure. This pressure eventually forces the contents backward, resulting in vomiting. Initially, the vomit may consist of recently consumed food. However, as the obstruction worsens, the vomit may contain bile, a greenish-yellow fluid produced by the liver that aids in digestion. Persistent vomiting can lead to dehydration, electrolyte imbalances, and malnutrition, further complicating the situation. If you experience vomiting that is persistent, projectile, bloody, or accompanied by severe abdominal pain, seek immediate medical care. We often take for granted our body's ability to eliminate waste regularly. Constipation, characterized by difficulty passing stool or the complete absence of bowel movements, is a hallmark symptom of intestinal obstruction. In the case of an obstruction, the passage of stool is physically blocked, preventing its elimination. The abdomen may feel distended and tender, and the individual may experience abdominal cramping and discomfort. If constipation is sudden, severe, or accompanied by other symptoms like vomiting or abdominal pain, it's crucial to seek medical attention promptly. While abdominal pain, vomiting, and constipation are the most common symptoms of intestinal obstruction, other subtle signs should not be ignored. One such sign is a noticeable decrease in appetite or a feeling of fullness, even after consuming small amounts of food. Another red flag is the inability to pass gas or flatulence. Gas is a natural byproduct of digestion, and its passage is essential for maintaining a healthy digestive system. When an obstruction is present, gas builds up behind the blockage, causing bloating and discomfort. Furthermore, pay attention to any noticeable swelling or distension in the abdomen. If you experience any combination of these symptoms, don't hesitate to seek medical attention. When facing the possibility of a roadblock in your gut, the journey to diagnosis begins with a trip to the doctor's office. your doctor will gather clues about your condition, starting with a thorough physical examination. This initial assessment is crucial in understanding the nature and severity of your symptoms. Your doctor will begin by asking about your medical history, including any previous abdominal surgeries, gastrointestinal issues, or chronic illnesses. Next comes the physical exam, where your doctor will observe your abdomen for any visible abnormalities. They'll gently press on different areas of your belly, checking for tenderness, guarding, tensing of abdominal muscles, and masses. The physical examination helps your doctor narrow down the potential causes and guide further investigations to confirm the diagnosis. Imagine being able to peek inside your body to see what's causing the trouble. That's essentially what X-rays allow doctors to do. When it comes to intestinal obstruction, X-rays are often the first line of imaging investigation. During an abdominal X-ray, you'll be asked to lie down on a table while a technician positions the X-ray machine above you. In cases of intestinal obstruction, X-rays can reveal telltale signs like dilated loops of bowel above the blockage and a lack of gas in the colon below the obstruction. These images provide valuable information about the location and severity of the blockage, helping your doctor determine the best course of action. In some cases, further imaging studies like CT scans may be necessary to obtain a more detailed view and confirm the diagnosis. When it comes to diagnosing intestinal obstruction, sometimes a clearer picture is worth 1,000 words, or in this case 1,000 X-rays. That's where computed tomography, or CT scans, come in, offering a more detailed and comprehensive view of your digestive system than traditional X-rays. CT scans utilize X-ray technology but take multiple images from various angles, which are then combined using sophisticated computer software to create detailed cross-sectional images or slices of your internal organs. For suspected intestinal obstruction, a CT scan can clearly show the location and extent of the blockage, the thickness of the bowel wall, and any signs of complications like perforation or inflammation. The detailed information provided by CT scans allows your medical team to make a more accurate diagnosis, assess the severity of the obstruction, and determine the most appropriate treatment strategy. While imaging tests provide valuable visual clues about intestinal obstruction, laboratory tests play a crucial role in uncovering the underlying cause and assessing the overall impact on your body. These tests analyze samples of your blood, urine, and sometimes stool to detect any abnormalities that could be contributing to the blockage or its complications. One of the most common blood tests is a complete blood count, or CBC, which measures the different types of cells in your blood, such as red blood cells, white blood cells, and platelets. Electrolyte levels are also crucial to check, as vomiting and dehydration can lead to imbalances in essential minerals like sodium, potassium, and chloride, affecting various bodily functions. By piecing together the information from both imaging and laboratory tests, your medical team gains a comprehensive understanding of your condition. Diagnosing intestinal obstruction is like solving a complex puzzle, requiring the careful assembly of clues gathered from various sources. Your medical history, physical examination findings, imaging results, and laboratory test results all contribute to forming a complete picture of your condition. The location, intensity, and duration of your symptoms, along with any associated complaints like vomiting, constipation, or blood in stool, provide valuable initial clues. Imaging tests, particularly X-rays and CT scans, offer visual evidence of the blockage, revealing its location, severity, and any complications. By carefully analyzing and integrating all these pieces of the puzzle, your doctor can confidently diagnose intestinal obstruction and determine the most appropriate treatment plan tailored to your specific needs. When intestinal obstruction throws a wrench in your digestive system's gears, swift action is crucial. The good news is, not all cases require immediate surgery. Your medical team will carefully assess your condition and recommend the best course of action based on the severity and cause of the blockage. The first step often involves close observation in a hospital setting. This allows medical professionals to monitor your vital signs, track your symptoms, and watch for any signs of deterioration. During this observation period, you'll be asked to refrain from eating or drinking anything, a temporary measure known as bowel rest. By temporarily halting the intake of food and fluids, you're giving your digestive tract the best chance to recuperate and resume its normal function. Picture this. Your body, a complex machine, needs fuel to function. But with an intestinal obstruction, the usual route for delivering that fuel, your digestive system, is temporarily out of commission. That's where intravenous or IV therapy steps in, providing a lifeline of fluids, electrolytes, and essential nutrients directly into your bloodstream. IV therapy is a cornerstone of treatment for intestinal obstruction, especially during the initial stages when oral intake is restricted. The IV fluids, carefully formulated solutions of water, salts, and sometimes sugars, help restore your body's fluid balance, preventing dehydration, which can further complicate the situation. Think of it as a pit stop for your body, providing the necessary tune-up and refueling to get back on track. Imagine a traffic jam in your intestines with backed-up contents causing discomfort and bloating. To alleviate this pressure and provide relief, your medical team might recommend a procedure called nasogastric or NG tube insertion. An NG tube is a thin, flexible tube that's gently inserted through your nostril, down your esophagus, and into your stomach. This tube acts as a temporary drain, allowing air, fluids, and accumulated gastric contents to escape, effectively decompressing your digestive system. NG tube insertion is particularly beneficial in cases of severe vomiting, preventing further fluid and electrolyte loss, and reducing the risk of aspiration, where vomit enters the lungs. This temporary measure plays a crucial role in managing symptoms and creating a more favorable environment for healing. Section 4. Medications, allies in relief and resolution. Managing symptoms and supporting your body's healing are crucial. Medications are valuable allies in recovery from intestinal obstruction. Pain relievers manage abdominal pain. Anti-nausea medications combat vomiting. Antibiotics target infections. Medications stimulate intestinal motility, often administered intravenously. Medications are one piece of the puzzle. Your medical team selects the most appropriate medications. Section 5. When surgery becomes the path. Addressing the obstruction. Surgery becomes necessary when conservative measures like IV therapy and medications fail. It's a decisive step to resolve the blockage and prevent further harm. The type of surgery depends on the obstruction's location, cause, and severity. Minimally invasive laparoscopic surgery often involves shorter recovery times. The surgeon will remove the obstruction and may need to resect damaged intestine. Surgery is often the most effective way to address the problem and prevent complications. Your medical team will discuss the risks and benefits to ensure you're prepared. Section 1. The importance of early detection. Listening to your gut. Early detection of intestinal obstruction is crucial. Your gut instinct can be your greatest ally. Don't ignore warning signs like abdominal pain or persistent vomiting. Ignoring these signals can lead to serious complications. Early detection often means less invasive treatment and smoother recovery. You are your own best advocate for your health. Section 2. Your digestive health, a lifelong commitment. Intestinal health is crucial. Regular care, a balanced diet, and exercise are key. Avoid processed foods and sugary drinks. Prevention is better than cure. A healthy gut promotes overall well-being. Section 3. Empowering yourself. Knowledge for a healthier tomorrow. Knowledge is power. especially in health. Understanding intestinal obstruction empowers you to be informed, vigilant, and a source of valuable information. Share this knowledge with loved ones, spreading awareness. The more we understand our bodies, the better we care for them. Your journey to a healthier tomorrow starts with knowledge. Stay informed, listen to your body, and seek timely medical attention. Your health is your most valuable asset. Cherish it, protect it, and empower yourself.